Welcome to the Care Social, where we discuss the biggest topics in social care right now. Whether you're a health and social care provider, a frontline worker, or just passionate about making a difference, we're here to bring you expert discussions, insights, and real stories from the sector. I'm Barry, Content Operations and Delivery Manager here at QCS. In this episode of the Care Social, we're joined by Joelma Fernandes and Neil Crawford from Access Skills, who are here to break down the Learning and Development Support Scheme, LDSS. Thanks for taking time to speak to me today.
Thank you for having us.
Thanks, Barry. Pleasure to be here.
So let's jump straight in then with a bit of a warm-up. So could you start by telling people that are listening to us, who is Access Skills and what kind of support you offer to the social care sector?
Okay, Barry, yeah. Access Skills, we were established in 2008, so we've been around a long time, and we're a specialist health and social care training provider. We offer a range of leadership and management qualifications, induction training, practitioner courses tailored to meet the needs of the sector. So basically, in providing our courses, what we're striving to do is support care providers to basically tackle the business issues, and particularly those around recruiting, onboarding, developing and retaining their workforces. We're very strong on partnerships, and that's why we're delighted to be here today with one of our key strategic partners, QCS.
What is statutory mandatory, or should I say, why is statutory mandatory and role-specific training so important, especially for social care providers and their teams? And what is the role of additional vocation qualifications, such as the diplomas? Why are they important as well?
Okay, there's qualifications that actually are mandatory, but they're actually very few in practice, because, you'll have things around the medication area, and you'll have things around perhaps first aid as being obvious examples of recognised statuted qualifications, but there are prescribed qualifications that are required but not specific. And so an example of that would be the registered manager, where a registered manager is expected to have a leadership and management qualification at level 5. And if they don't have a qualification at level 5, then they're advised by Skills for Care as to which qualification is most suited to that need, which is the level 5 diploma, which has been developed specifically for that purpose. But it's not exclusive and it's not mandated. So, and there are a number of areas within the sector, where that's the case. If you take around induction, the question of the care certificate standard, the 15 outcomes, and is that a qualification or is that a standard? Do I have to do it? And do I have to do all the bits of it prescribed? There's lots of direction, but mandating is a strong word, and there are actually in practice very few mandated qualifications. In terms of the actual diploma qualifications, it's clear that they, if you're looking at a health and social care diploma at level 3 or 4 or 5, they're very specifically designed to bring out the key knowledge, skills and behaviours of the practitioners operating at those levels in the sector. And so they're very relevant for the roles, and they're very, very much part and parcel of somebody demonstrating and having an independent verification of what they're capable of doing in that area. And of course, very well established in the sector over a number of years now. They used to be called MVQs, and many people still refer to them as MVQs, National Vocational Qualifications, but they're very specific and very competency based. This is the important thing with the qualifications in this sector. It's not about talking about things in isolation. It's also about demonstrating that you can apply that knowledge, skill and behaviour in the right way.
That's where I had my slip up earlier on. Is I did my first MVQ3 in 2005, so they've been around for a substantial amount of time. And then I went on to do my level 4, and then a few years later, 2013, completed the level 7, all with really, really good mentors and instructors from external providers like yourselves. So there's a really good baseline for me. And sometimes it's good having somebody external to the workplace supporting you doing those qualifications, because they can go into a little bit more detail. I've had a lot of staff that are not very good at written work, and I think the way it's turned around now, where those going around and doing the qualifications, you can say, talk me through that. So you don't have to do the writing as much as you used to do now. We know many providers then are struggling because it is a minefield to access free or affordable training. So what do you think are the main barriers then? How can Access Skills help social care providers overcome these challenges?
Yeah, I think the positive, if I focus on that first, the health and social care sector is relatively well placed compared with other occupational sectors, because there are government funding opportunities available in this sector that are not repeated in other occupational sectors. And therefore, there is more opportunity to find funded training as an employer, as opposed to if you were an employer in, say, like the hospitality sector or other sectors. And so that has to be a very strong positive, that the funding is out there. The other positive is that largely the barrier is awareness of what is actually available. In principle, that's a barrier that can be overcome very straightforwardly. We have Access Skills as a training business. We're expanding by the day the range and approaches that we take to our social media communication strategies of trying to get the messages out to the audience in as many different ways that hopefully at least one of these attempts they will be able to latch onto. And of course, we're sitting here today doing a podcast, which is very much part of both our strategies, both QCS and Access Skills, to give another opportunity for people to find things out. We have a very strong focus on providing information, advice and guidance to our clients, and we have we almost have as many people in that area of the business as we do in actually delivering training, it seems, these days. So the positive first is that there are opportunities out there, and you just need to take a bit of effort to pick out a podcast or an email, a registered manager group comment on Facebook or wherever to actually get you motivated and in the right direction. It's not all good though. There are issues. Government policy around the skills agenda with driving funding has quite honestly been a complete shambles for at least the last almost 10 years. We have some headline funding opportunities, which are available to all occupational sectors, which is the apprenticeship programme. That is the headline government policy area in terms of skills training. And it's been completely challenging for everybody involved in the apprenticeship world for the last 10 years, because they've gone in a direction that hasn't sat very comfortably with the needs of employers in the adult social care sector. They've brought in all sorts of additional requirements associated with the content of an apprenticeship programme, but also the method of delivery of those programmes. And it just hasn't sat well. And so we've seen in recent years a significant decrease in the amount of engagement in apprenticeships with the adult social care sector. And I'm just lingering on this at the moment because it's a right political hot potato right now as we're speaking. Big announcements have been made in the last week about apprenticeships and the adult social care sector. And the reality is that then in the last 10 years that the numbers of employees engaged in apprenticeships has actually gone down. And in terms of the private adult social care and health sectors, it's gone down significantly. So there are some real challenges there. I think also that funding pretty much is clearly focused around qualifications and not training. And I think many of us operating in and around the adult social care sector would say that training is the issue of the moment, training people to be more competent and to be able to display the right behaviours in the roles that they perform, and of course knowledge associated with doing that. There are very few funded training opportunities available out there. There's some around leadership and management from the endorsed programme, for example, from Skills for Care, but very, very limited, particularly around clinical training, which I know many of the listeners will be concerned about. And then if I just say a personal note from us as a training provider, the training provider community, the FE colleges and the independent training providers have suffered a lot in the last 10 years as a result of much of what I've just been describing. And so there are fewer training businesses out there now. I think there's always been quite a few businesses that exclusively focus on adult social care and that sector. There are even fewer now, I can tell you that. Many of the big players that people may have been engaged with in the sector in previous years, government policy has driven them from the sector too. So it's quite challenging all round.
I think just on actual examples from people struggling and employers struggling and businesses struggling with, accessing free and affordable training. A lot of the main problems the guys, for example, on our end get from employers, we're speaking to employers every day, is one is definitely knowledge, knowing what's out there, knowing what's available, knowing what they're entitled to, what they're not entitled to is a big thing, because the information is out there, but that doesn't mean they necessarily know where to get that information. And even the information that is out there doesn't mean it's easy to digest. A lot of them, they go on to Skills for Care and there are a lot of reports on there that they can read, but they just want a quick solution and an explanation of how things work. sometimes they just have no idea where to even find that. And we're seeing a lot more employers who usually would have gone down the route of an apprenticeship, for example. We've had a levy employer that we've worked with for a while, and they've actually come back to us in the last week and said that they've given up with apprenticeships, even though they're part of the levy scheme. They've given up because of things like the off-job hours, and they're saying that, you know, all the tri-party reviews, it's very demanding. It demands a lot, not just on the individual, but the business and the employer's involvement in it. And they're just looking for other solutions out there because, yeah, like Neil said, apprenticeships just don't seem to be the answer anymore. They're just not the go-to as they once were.
And as a registered manager that's been in that position, it is hard work, you know, and you haven't got time to over and above the 9 to 5 work.
I think it applies a lot from our experience of working closely with many of our clients. I think from the registered manager perspective, very often, if they trust the source of the information, then they're quite happy to be told what to do. You know, this is a demanding, challenging, stressful job that people are performing. And so this is one less thing that you have to worry about. Then you're happy to be told what to do. I think that it's quite challenging finding organisations that you can work with, that you can build that relationship with to have that confidence. But hey, this all sounds a bit negative. So let's be really positive. You know, just finally, the new Learning and Development Support Scheme, the LDSS scheme, that is a really positive thing. I'm sure, Barry, you're going to ask us a few questions about that as we go through this conversation.
Let's move on then with the LDSS. What funding options are available for social care providers to help cover that cost of training or get some advice on how to do it? Again, how can they find out if they're eligible for support? And are there any particular types of training that are more easily funded than others to make that transition into training and development externally?
Perhaps if I pick up on the what bit and then you pick up on the how bit, Jojo. But
of course,
in terms of the what bit, the LDSS, it's a relatively straightforward and easy scheme that's been introduced. For those who are not familiar with it, it's effectively replaced what was previously the Workforce Development Fund that people may have experienced. It's been around for many, many years, the Workforce Development Fund. It usually involved you having to join a regional partnership, care providers that would be organised by typically one of the major local authorities in that area. And you would have access to funding that you would claim for qualifications largely once the individual had completed the qualification. The coverage of the new LDSS scheme is quite similar to the Workforce Development Fund in terms of those programmes, which are largely qualifications that the fund will actually contribute towards the cost of. It does pick up some training, so the Skills for Care endorsed management programme is available on there, and there are one or two other smaller types of provision that you can fund. But essentially, the big difference is that it reflects the modern world, so it's a big national portal. It's very easy to interact with the mechanisms that the government have put in place here. It's run by the Department of Health and Social Care, so the DHSC. It's very much building on the apprenticeship levy system, which people found quite challenging and demanding when that first came in, and perhaps for some people touching it for the first time, they still find it quite challenging. But it has been improved, and we're seeing lots of that sort of improvement and thinking appearing now in this brand new government portal. But the big difference is that they will pay a significant proportion of the funding immediately up front. If I give one example, our biggest selling product at Access Skills is the Level 5 Leadership Diploma for the registered managers. You can get funding from the LDSS up to £1,565 for the cost of that programme, and you will be paid 60% of that up front and the remaining 40% when the person achieves. And if you're fearing, well, what happens if they only get halfway through the programme and they leave? Because we know in the sector, for example, there's a horrendous turnover rate in registered managers in their first year of service, which is one of the big issues for the sector. Then what happens then? The good news is you don't have to repay the 60%. Clearly, you won't be able to claim the 40% because they haven't completed the programme. But, you've got a certainty there, which wasn't present with the Workforce Development Fund. You just would not have been able to claim anything back with the previous Workforce Development Fund. So I have to say that this is really quite a positive. They've committed quite a sizable resource from the civil service side of the fence with this to make sure that it becomes as slick as it possibly can be in administering those claims. So that's really something I would urge all care employers to seek out information on. And Access Skills is just one of many sources where you can find lots of things out by that. And I think also very importantly, that source of funding, unlike apprenticeships, for example, which listeners will know who have engaged in apprenticeships, there are all sorts of eligibility criteria that applies to whether an individual can be enrolled onto a funded apprenticeship program. Overseas workers, for example, can't be on an apprenticeship program, etc., etc. With the LDSS fund, they've swept much of the eligibility away. The eligibility simply is, are they a worker of your organisation based in England? Basically, so it has to be any employed worker, which can be an overseas worker or anybody else you're employing, as long as they've got a national insurance number, i.e. they're on payroll, then they're eligible. It's a really big step forward, this, and getting 60% of the funding once you paid for the course. So, it's not without its considerations. You have to pay for the course to get your money back. But, most people would say, well, that's not reasonable, is it? But, cash flow and those sorts of issues are still a consideration for people. But this is a massive step forward.
Yeah, and then in terms of the how, it's actually pretty straightforward as well. The first thing employers have to look at is obviously the workforce data set. You need to ensure that you are on there and that it is updated. That's the first requirement that they ask. Other than that, it's just a matter of registering your interest through the LDSS website, which is just a small form. Our employers have said it takes about 5 minutes. I've actually had a look at it myself. It just asks for very simple, basic information, name of the company, address, national insurances and things like that. That's all through the workforce data set. For that form, you're literally just putting your business details on there. And then the next thing that happens is obviously the government will then send you an email to onboard you onto the portal. Once you're on the portal, it's just submitting claims. So the claim does need to be submitted within 3 months of the learner being enrolled. They do ask for some evidence. So in terms of evidence, it's just payment statement. So they want to be able to see that you've paid for that course in full. If you're going down the 60-40 route. If you were to just want to claim that, you do have the option to also claim 100% of it at the end of the course if you didn't want to do the 60-40. I don't know of any employers that have gone down the 100% route. Usually they want that 60% straight away. In terms of submitting, they just ask for a bank statement that is obviously on the company card so they can see that this company has paid for this person on this day. And then from the training provider side of things, they also want a statement from us to say, yes, we've received this on this date, they are enrolled and they're doing this course. As long as the name, the course, and obviously the amount matches all evidence submitted, your claim then gets approved. So we've worked with a lot of employers at the moment going through this. The main issue with the LDSS at the minute is the onboarding process. It's very quick to do, but then there is a slight wait for the government to get back to you and obviously give you access to the actual portal because they've just had an influx of people registering their interest. We knew this was probably going to be the case at some point. The more obviously people register interest, there's a backlog at the minute. So employers are being told that it can take up to from 6 to 8 weeks at the moment. So we've just been telling everybody, even if you're not 100% sure that's the route you want to go, register your interest at the very least. You could be missing out on funding for your staff, just making that easier to invest in your staff as well. The only other thing is it depends on how many people you're also putting through. So for example, one of the organizations we worked with, they only had a couple of learners. I think they had 3 learners that they put through. Within a couple of days of submitting the claim, they actually had the 60% back. But then we also had another organization who put 12 staff members through at once. And obviously they had to wait around 2 weeks to get that 60% back. So it depends on how many staff members you're claiming for and obviously the evidence you're submitting. But other than that, it is very straightforward. And we have guides and resources on that, which we're able to provide our employers with to make the journey easier for them. But it is a very straightforward process.
Well, that's my next question, actually. What are the first steps then a provider should take if they want to start working with Access Skills to access the funding, or even to look at the other training opportunities that you've got? How do they do that? And what advice would you give to a social care provider? Think about those single owner operators that are doing everything, the nominated individual, the director, the registered manager, never applied for funded training before, that might feel a little bit overwhelmed. How do they do that with Access Skills? Who do they contact?
Pick up the phone and ring us. I would say visit our website. We're waiting on the other end for you. We've been waiting to help you through this. That's what we're here for. We have various ways in which we provide information. Obviously, we are also matrix accredited, which means our information, advice and guidance is effective, well managed, very client focused, and we're continuously working on improving that. We've got social media channels. We have registered manager groups where everyone gets to sort of have a discussion around all the similar problems that they're currently facing, and registered managers can lean on each other in that sense as well. We have loads of specialized webinars. We recently had one on CQC framework of inspection. We have an amazing team who are always willing to help. If you want a phone call, if you want a Teams call, we are there to hold their hand through the whole process, whatever way that may be. We're there. Just call us. We're here.
Yeah, the website is obviously an obvious first reference point. You can inquire on there. So if you don't want to ring, you just want to drop us a line through the website inbox. There's lots of opportunities there, and we're just about to launch actually our new WhatsApp channel. The whole world, it seems to be communicating via WhatsApp, so we're maybe slightly slower than many, but we're actually joining that particular party shortly, and please get in touch. But I just wanted to say one little thing about adult social care workforce data set. That's been around for a long time now, and many of the statistics that we all quote, and Skills for Care as the important player in the sector coordinate the activity around that. It's informing all the numbers, turnover rates, what's going on, etc., in the sector, and very, very much dependent on care providers providing them with the ammunition to be able to do that through participating with it. It is a condition of the new LDSS, as Jojo said, that you do engage with the LDSS, with the data set, sorry. And many people may say, well, that's a burden, can't be bothered, I haven't got enough time, I've got too many staff to keep on top of, etc., etc. These are things that are often said to us. But I would say that, yes, you're potentially turning down then a significant amount of funding here. The funding for the new LDSS is limited to £400,000 per individual employer. In reality, those that do the maths, if you're a geek looking at the government side of things, they haven't got anything like enough money to pay £400,000 to every employer in our sector. So in reality, we're probably talking of a figure of around about £10,000 to £15,000 is nominally available for an average, SME size care provider. That's a lot of money. And if you try and cost out the amount of time, but I'd also say something very important as well, which is, you're completing a PIR, the provider information return each year, and that requires the detailed staffing data to be supplied as part of the inspection process that would follow. And so if you've actually completed it on the data set, CQC will not ask you for that data. They go straight to the data set to see the employer details for your organisation. So if you've got to do it anyway, you have to do it for your annual inspection process, then there's no real argument then, just do it on the data set and get all this funding as a benefit of doing it,
Full disclosure, Neil, I was one of those people that had an adverse reaction to the data sets. Hated it, absolutely hated it, but in hindsight I probably lost a lot of money by doing that. How do you see the role of training changing in social care, and how do we change the narrative where we're still seen as low skilled?
It's I think if I answer this firstly from the provider perspective, of a training provider perspective, then I feel as a specialist health and social care training provider that we properly understand the issues that the people that we're talking to, registered managers, owners, senior staff within the business, as well as obviously learners, reinforcing those messages. We're pretty tuned into what's going on in the sector and what the business issues actually are. And so I think that you need to be able to empathise and offer up to individual client care providers clear signs that the training and development products that might be discussed with them are very relevant to those business issues, because that will give the client confidence that you understand what the issue is that they're trying to address, but also that you can tailor what you're doing toward addressing those issues. And so, I'll give one example of how we're having to now grow and evolve as a training organization. I mentioned earlier, we've got a hell of a lot of investment in information, advice and guidance, because we know that people need their hand held when you're talking about the data set. They'll very often, with a member of our staff, they'll clock in and share the screen, and we're helping them put the data in, as they talk. So that's one example. But another example would be if you go to the Access Skills website now, you'll see that we've recognised that the biggest issue at the moment in the sector probably is staff. It's about recruitment, it's about retention, it's about developing and training staff. And so we've decided, well, why wait for people to approach us with individuals they've recruited and talk about training and developing them? Why don't we help them find the individuals in the first place? We've often at Access Skills website get lots of inquiries from individuals who are in between roles within the sector. We have obviously a massive percentage of the workforce are female, and they have the usual things that go on in a female world of work in terms of maternity leave and part-time work and all sorts of issues. And the workforce does circulate quite a lot, and it's really interesting when you look at some of the statistics from Skills for Care about age profiling and experience in the sector and the link to retention in jobs going forward. We decided, right, okay, we'll create a job board so that those individuals who are inquiring at our website, who are currently not in work and therefore can't do one of our set piece diploma qualifications that require you to be in the job to allow your competency to be observed, we wanted to give them somewhere to go and to link them up with employers who are desperately looking for people to employ, who have the right outlook and perform the roles effectively. And so we created something called the Care Wizard, which is a job board, which is advertising all the jobs going on in the sector and giving an opportunity for individuals to see them and for employers to see them in a way that brings the two together. So that's a second example of us recognising the business issue, which is you need staff. You can't talk about training people you don't have. So let's help you try and do something about finding the people in the first place. And we'll start training them right from the get-go and then hopefully stay with them through their entire career with you as an employer. So I think finding organisations that can genuinely offer that sense of support to those business issues is really important, and really an opportunity for training organisations to step up to the plate in terms of trying to be able to, offer that. The other thing, biggest thing, it affects all our lives now, not just the care sector, not just the training world, is new technology. AI is an absolute game changer for us all in all our everyday lives. And I think that's going to have a massive impact on what the future of training looks like for organisations. It's going to give us the ability to make things much more visual for people. We know this is an issue in our sector where people are coming from very often from a starting point that maybe weren't as developed academically as other occupational sectors would expect new entrants to be, and all of those challenges associated with that. But the people that we have in the care sector, the people that stay in the care sector, they're very much focused on what they can do, the competency they offer. And I think showing them things very often is a much more powerful thing than explaining them things. We're all the same. I was just recounting to the staff this week, I've just had a new fridge. It talks to apps and all sorts of things, the equipment you get now. But the guide was half a side of A4 with nothing telling me about anything. It was simply a barcode, scanning the code, and a video pops up and tells me all about it. And I think that's where the training world will move very, very rapidly. It's already moving there quite quickly. We as an organisation are starting to do that. And I think that then provides an opportunity for us to provide things very much more flexibly than we've ever been able to do, that can fit in with the needs and the availability of individuals to engage and to develop. And I think that's going to be particularly important in a key area for the care sector, I believe, in terms of around the domiciliary agenda, if I label it that way. I think there's going to be a massive expansion in the range of service provision in what has traditionally been viewed as domiciliary care, i.e. supporting people in their own living environments. I think we're going to become more discerning as individuals about what we want and what we expect and what we will engage with and what we will pay for. And I think the care providing world that can create more flexibility in how those models can work, combined with the flexibility of technology, which will allow them in part to do some of that, but supported fully with very flexible training that runs alongside it. And I think the emphasis over for me is training. It's not qualifications, it's training. Qualifications are a good way of confirming certain things, but training and providing that in a way that can really impact on people and be evidenced in how they behave and perform in their job roles. I think that's the future, and I'm really upbeat about it. I find, unfortunately, I've had to wait 65 years in my life to start to see things that I think are going to change very, really quickly.
I'll take over. It's okay. It's all right. I'm here for you, Neil. You haven't had it for very long. I'm only in my 30s, so I'll see the rest of it out. Don't worry.
So what's the one message then to round off that you'd like every social care provider listening to take away when it comes to training and development?
I think when it comes to training and development, I was reading not too long ago a report by Skills for Care that they published in 2023 known as the state of the adult social care sector and workforce in England. And I just think a key thing that we need to remember is the more we invest in our staff, the more we invest in the business. And from speaking to people and individuals paying for themselves through obviously qualifications, as well as employers funding training and qualifications for their staff, there seems to be a disconnect there, because when I speak to, for example, individuals that are trying to invest in themselves and they're trying to self-fund these courses, trainings, qualifications, whatever you want to call it, a lot of them have that feeling that actually I want to do this and then I want to move on, because they haven't felt that support from their employer. They haven't felt like the employer was invested in them. Therefore, they want to invest in themselves and then move on. So I think with all the government announcements, obviously, that have happened, which Neil has already mentioned this past week, especially around, obviously, overseas workers, I think more than ever, it's incredibly important to invest in the staff that you currently have now. There is more than enough funding out there. I know that it's not,
Perfect.
The information isn't there for everybody to see right in front of you, but that's what we're here for. That's what we want to help with. We want to help individuals. We want to help employers. We just want to help everyone make the best decision. But above all, invest in your staff and they invest in you. That would be my takeaway from that.
Strong message to finish. Thank you both for your time today. I've really appreciated it, and hopefully people will get on board, and may your phone lines be busy.
Both our phone lines.
Well, that's it for this episode of the Care Social.
Thanks, Barry.
Thank you for having us.
If you'd like to know more about Joelma Fernandes and Neil Crawford, you can check out their LinkedIn profiles. If you'd like to know more about Access Skills, visit their website. If you found this podcast helpful, please share it with your colleagues. Have a topic you'd like us to cover? Comment below or email us at qcs@qcs.co.uk. Thanks for listening. See you next time.